everyone, this is Dr. Juliet. Welcome to today's A to Z Dog Health Care. Today we're gonna talk about teeth and nails. What do we have to do to prevent disease through teeth and nails? What do I need to do? How do I have to take care of their teeth and their nails? We're gonna start with nails. See, Bondi is a dog and he has 5 fingers in the front. So he has 1 nail there, 4 other there, another there. He has a little bracelet from the girls. And here in the back he has only 4 digits. Some dogs, some breed dogs, they have a 5th finger in the back too, with an extra wolf's claw, we call it extra finger. When your dog has this nail should be clipped too. An important aspect is that when you have your puppy or your dog, when you make them used to nail clipping, even brushing their teeth, it's important to do that when they are young. Because when they are young, they just don't move, you know. You can just clip their nails. They maybe move a little bit, but actually most of the time they just enjoy it, like Bondi here. The front nails, actually, they don't have to be cut so short. There's actually a little rule. If I push the nail and I make a straight line in between the pad and the extremity of my nail, I will actually be able to cut a straight line, up, a little straight line, voila. And actually I have to show you, for example, this finger I cut a little bit too short. I did it on purpose to show you that it's not a problem. It may be a little bit tricky, it bleeds a little bit, but that's not a problem. If it bleeds a lot, if you have cut too much, then you have to be careful. White nails are easy to recognize where you have to cut because you see the vessel, you see the blood vessel, and then you see that you only have to cut that little bit of white. Black nails, like this one for example, is a little bit more difficult. But most of the time, the nails that are growing all the time or these 5th little fingers here, these fingernails, you have to look at them whenever, because even if your dog is doing exercise, they don't lose their length. So it's really important to check the length of this finger because it can grow into the skin. But some dogs who do a lot of activity, actually they don't have that problem. Even this 5th finger touches the floor because they actually run a lot. So one thing is, make your puppy used to nail clipping. There's no harm. If you don't feel comfortable, you can ask your veterinarian to do it. We do it with pleasure, but we do it with pleasure on dogs that are a bit behaved. So make your puppy used to pet, to touch him. He lays there. It's really important that I don't have to run after them during the consult time. Other little aspect also are the teeth of your dog. So Bondi is actually an example of a dog where I can show you his teeth. His teeth are not perfectly white here. Actually, because I forgot, or I was a little bit lazy on giving him what I estimate is the most important for teeth health, a raw bone. So the last weeks I was not there and I have forgotten a little bit on giving him raw bone precise that he can crunch in there, so this cleans the teeth. Because people would say, like on kibble, yes, this brushes their teeth, but kibble is also full of carbohydrates, full of starches, and this doesn't mean that the tartar won't come. Tartar comes because bacteria accumulates feeding on carbohydrates. So even homemade food, when it's full of carbohydrates, will also attract bacteria who are gonna live on tartar. So the most important thing for me about teeth health and prevent that the bacteria go into the circulatory system and at the end cause heart and kidney problem is about feeding them here, Bondi, raw bone. So this is a piece of dehydrated bone and he will crunch on it, he will chew on it, like he wants to go, but he can go. You can sit here, Bondi, so, and he will actually go chewing on his bone. This will brush his teeth and you will see there will be a really nice white and strong until the end of his days. So this was a little bit about teeth and nails. I hope you enjoyed the question of today. Please subscribe to my channel, Dr. Juliet de Caestecker, and see you tomorrow for another question. Bye.